In a world where we expect doctors to heal and help, one shocking moment turned the medical world upside down. Imagine walking into a hospital, trusting the system, only to be refused the care you desperately need simply because of the color of your skin. It sounds unimaginable, yet it happened. This is the story of a black veteran who was denied medical treatment by a doctor, a decision that would spark outrage, shock the nation, and ignite a firestorm of change. But what this veteran did in response to the refusal will leave you stunned. In this video, you will discover not only the heart-wrenching details of this extraordinary incident, but also the incredible actions the veteran took that forever altered the course of medical history. You'll hear about the legal and social aftermath that few people are aware of, and how this one moment led to a ripple effect across the healthcare system. Stay with us till the end, because the shocking twist in this story is something you won't want to miss. The truth about what happened is more than just an act of bravery. It's a call for justice and equality that still resonates today. Welcome to Craze TV, where we uncover the most impactful stories that change the world. If you haven't already, hit that subscribe button and join us as we dive deep into this unforgettable story. Let's get started. It was a typical day in a small town hospital. The waiting room buzzed with the soft hum of tired patients and the occasional call of names. For most, it was just another visit to a doctor's office. But for one black veteran, it would become a life-changing moment. He had served his country, fought for freedoms that many of those around him took for granted. Yet, when he walked into that hospital, a place where he expected to be treated with the same dignity as anyone else, something was wrong. His appointment was set, and his medical issue was serious. But as he approached the doctor, something felt off. The doctor, a respected figure in the community, greeted him with a coldness that felt more than just a professional distance. There was something in the doctor's eyes, a hesitation, a judgment. It was a look that said, "You don't belong here." The veteran didn't fully understand it at first, but it soon became clear. The doctor refused to treat him. Just like that. No explanation, no medical reasoning, just a flat refusal, as if he was unworthy of care. It wasn't about the veteran's health or the urgency of his condition. It was about the color of his skin. Racial prejudice, whether overt or subtle, shaped that moment. The doctor, driven by deep-rooted bias, made a decision that would not only affect the veteran's life, but would also send ripples across the medical community. This wasn't an isolated incident. It was an example of something much larger. For many, this refusal wasn't just about a single doctor's action. It was a reflection of a system that had, for so long, allowed discrimination to thrive in places where people were supposed to feel safe. The refusal wasn't just about one man denying another care. It was about the power of prejudice to strip someone of their humanity, even in the most trusted spaces. And for the veteran, that moment marked the beginning of a fight that no one saw coming. The veteran stood there in silence, staring at the doctor who had just denied him care. The sting of the refusal was sharp, but what hurt even more was the realization that this wasn't just about his health. It was about the system that allowed this to happen. He had fought for his country, sacrificed his safety for the freedoms of others, and yet here he was, denied the most basic right: medical treatment. Most people would have been consumed by anger. They might have yelled, made a scene, or even sought revenge. But this veteran, despite the weight of injustice bearing down on him, took a deep breath and chose a different path, a path that would defy expectations. He didn't raise his voice. He didn't resort to violence. Instead, he calmly turned away from the doctor's office, leaving the hospital behind. But not the issue. It wasn't the end of his story. It was only the beginning. What happened next took everyone by surprise. The veteran didn't quietly accept what had happened to him. He decided to take action, to make sure no one else would have to face the same humiliation. He reported the incident to the hospital's administration, making sure that those in power understood the magnitude of the refusal. But he didn't stop there. The veteran's actions escalated quickly. He realized that to make real change, he had to stand up for more than just himself. He took legal action, seeking justice not just for the discrimination he faced, but for the countless others who had likely suffered in silence for years. His story began to spread first in local news, then nationwide. People were shocked by the boldness of his response, but more importantly, they were inspired. The veteran's refusal to be silent in the face of injustice resonated with so many who had been pushed aside for reasons beyond their control. What began as a single moment of denial grew into a powerful movement, a story of resilience, of standing up for what is right, and refusing to accept a world where prejudice dictates who gets care and who doesn't. As news of the veteran's bold decision began to spread, people across the country were left speechless. No one expected such a quiet, yet powerful, response to such an injustice. Within days, the story hit the headlines, and the nation couldn't stop talking about it. His actions were a stark contrast to what most would have anticipated. Rather than escalating the situation with anger or violence, he chose to take a stand through legal and public means. And it was this calm resolve that captured the attention of millions. Social media platforms exploded with posts, hashtags, and stories of solidarity. People from all walks of life were compelled to share the story. The veteran's quiet courage resonated with so many, especially those who had long been victims of similar discrimination, yet had never found a way to voice their pain. His actions gave them a voice, a sense of power to challenge the status quo. It wasn't just one man standing up, it was a collective awakening. This wasn't just a case of one individual taking a stand. His actions sparked a nationwide conversation about the uncomfortable truths lurking beneath the surface of healthcare systems. People began to ask, how many others had been turned away because of the color of their skin? How deep did racial bias run in medical institutions? The questions were uncomfortable, but necessary. The veteran's decision, in many ways, opened the floodgates to a broader dialogue about racism in healthcare, something that had been swept under the rug for far too long. Stories began to surface, revealing cases where others had faced similar treatment but had stayed silent. The courage of this one man had brought attention to a crisis that many had ignored, or worse, accepted as normal. His actions didn't just spark outrage, they forced society to confront the reality of systemic racism in a place where everyone should feel safe, the doctor's office. Though the veteran's journey wasn't easy, it marked the beginning of a profound shift in how the medical community viewed racial discrimination. His brave stand against injustice quickly turned into a larger movement, one that began to challenge the very foundations of racial bias in healthcare systems across the country. The veteran's decision to take legal action, combined with the widespread public support, forced those in power to take a hard look at the practices and policies that had allowed such discrimination to persist. In the days and weeks following the incident, the hospital where the event occurred was under intense scrutiny. Investigations were launched into the doctor's behavior, and it became clear that the issue was bigger than just one doctor's actions. The case highlighted how deeply ingrained racial prejudice could be, even within institutions that were supposed to be neutral and caring. As the public outcry continued to grow, hospitals and medical associations began to implement new policies aimed at preventing discrimination. Medical staff were required to undergo anti-bias training, and new protocols were introduced to ensure that patients were treated equally, regardless of their race or background. The healthcare system began to look more closely at its own shortcomings, and the push for diversity and inclusion became more urgent than ever. But the impact didn't stop with policy changes. The veteran's story also inspired legal reforms. Civil rights organizations and advocacy groups took notice, and soon, legal challenges were mounted to ensure that such incidents couldn't be brushed aside. Laws aimed at fighting racial discrimination in healthcare gained traction, with many calling for stricter regulations and oversight of medical institutions to guarantee fair treatment for all. What began as one veteran's courageous act of defiance became a rallying cry for reform. His actions sparked a nationwide movement that led to lasting change, one that would challenge systemic racism in healthcare for generations to come. The case didn't just end with the veteran. It was the spark that ignited reforms designed to dismantle the very systems that allowed racial inequality to thrive in one of the most trusted spaces of all. This story isn't just about one man's fight for justice, it's about a collective effort to make sure this never happens again. The actions of one courageous veteran ignited a powerful movement, one that shines a light on the deep-rooted racial discrimination that still exists in our healthcare system. His bravery reminded us all that standing up against injustice is not just a personal battle, but a responsibility we all share. As we reflect on this story, think about it for a moment. What would you have done in his shoes? Would you have been able to take the same path of courage and resilience? The fight for equality doesn't end with this one story. It's an ongoing battle, and we all have a role to play in shaping a future where fairness, dignity, and respect are the rights of all people, no matter their race. If you found this story powerful, don't forget to like this video and share it with others to keep the conversation going. And if you haven't already, make sure to subscribe to Craze TV for more stories that matter. Together, we can make a difference.